I'm from Venezuela. I have been here in Miami for 10 years. I have been married 24 years and I have 3 sons. One is 21, the other 19 and 11. 20 years ago, my mom had breast cancer, and then in 2020, she was diagnosed with ovarian cancer. So I decided to do the BRCA1 test. When the result came and I was positive for the mutation, I decided to have a double mastectomy and a radical hysterectomy. Then everything started with the problems. Short of breath, like hot flashes. Everyone told me, don't worry about it, everything is fine. Is that you're anxious because your mom with the cancer, you with the double mastectomy. No, I knew that something was wrong, so I decided to go to the ER on Saturday 10th. And they performed a lot of tests, and they told me that I was having a pulmonary embolism, a massive one.
A pulmonary embolism is a blood clot that's typically formed somewhere else in the body, such as the legs or the pelvis. The reason a pulmonary embolism can be dangerous and can be quite dangerous is when it travels to the pulmonary arteries, it blocks off blood flow to the pulmonary arteries. That results in a decrease in your body's ability to oxygenate the blood, but more importantly, it acts as a dam and the heart has to pump harder and harder to try to bypass that blood clot. When the heart starts pumping harder and harder, the heart can actually start to fail.
They did some blood tests. I know that one value was super out of range, so they were concerned about it. They performed a scan, and then, they say that it's a pulmonary embolism, and Dr. Powell, my guard angel, appeared and explained everything to me.
We believe the cause of the pulmonary embolism in Mariana's case is that she had recently undergone surgery, and that is a risk factor for developing blood clots and secondary pulmonary embolism. The first line of treatment is anticoagulation medication alone. However, after we reassessed her in an hour, it's clear she wasn't doing better. In fact, she was actually doing worse. Her heart rate was increasing, and to us, this was a woman who is not only suffering a significant pulmonary embolism, but who might actually die from the condition. So therefore, we decided to perform a percutaneous intervention. With the percutaneous intervention, what we do is we go in with a catheter, first assess the pulmonary artery, and then we introduce a tool that can actually remove the clot from the lungs.
I say bye to my husband, say bye to my kids, but knowing that I was in the best hands in Baptist and Dr. Powell.
Well, Mariana is doing fantastic today. She's completely recovered from her pulmonary embolism, and her prognosis is fantastic. She has no long-term sequelae from the pulmonary embolism. We've had CT scans that show the clot is completely gone, and her prognosis is excellent.
I don't know how I'm alive. I feel like 21 again, but healthier and wiser and stronger because I learned a lot with that situation. But I'm feeling okay. My mom is okay, thanks to Baptist too. We're very grateful.
One of the lessons here that is if you're feeling sick, you're feeling short of breath, you should seek care in the emergency room immediately because those can be signs of a pulmonary embolism.
Dr. Powell, thank you so much. You are the best doctor. He's one of a kind.